It's the top of the hour, so we'll get started. I'm Dio Agus back in Houston. I'd like to welcome everyone to today's GlomCon session. Today's seminar series session is titled Antiphospholipid Nephropathy, a 2023 update. And our speaker today is Dr. Surya Seshan, the Chief of the Division of Department of Pathology and Laboratory Medicine at New York-Presbyterian Hospital and Weill Cornell Medical College. And the session will be moderated by Dr. Carmen Avila Casado, Professor of Pathology at the University of Toronto, Director of Education at LMP-UHN, Director of the Renal Pathology Program at Toronto General Hospital. GlomCon is a global effort we thank all of our participants, all of those behind the scenes. And today we would like to thank one of our corporate sponsors, Novartis. Novartis is a global healthcare company based in Switzerland that provides solutions to address the evolving needs of patients worldwide. Currently, Novartis has launched 4 clinical trials in glomerular disease with indications including a phase 3 study to determine the efficacy and safety of iptacopan in adult patients with atypical hemolytic uremic syndrome, naive to complement inhibitor therapy, a phase 3 study to determine the efficacy and safety of iptacopan in patients with C3 glomerulopathy, a phase 3 study to determine the efficacy and safety of iptacopan in patients with immune complex MPGN, and a phase 3 study to determine the efficacy and safety of LMP-023 in primary IgA nephropathy. So we're thankful for their support and your support for being here. And with that, I will turn it over to Dr. Avila, and she will introduce our speaker again, and we'll get started.
Thank you, Carmen, for the kind introduction. Good morning, good afternoon, good evening, and good night to all our colleagues around the world. I have a problem with my throat today. I will try to. I have a problem with my throat today for the last couple of days, but I will try to be as as clear as possible. I would like to thank Dr. Carmen Avila Casado and the team from GlomCon for inviting me to speak today and also give this opportunity to share what is happening in the world of antiphospholipid antibody syndrome. So I wanted to start with the basics first so that we can familiarize ourselves. This, was first described, these findings were first described by Professor Hughes in London in the 1980s. He wrote about it, although it became as a syndrome and as a disease towards the end of the 1980s and early 90s. At the time, he said, he described this as a recurrent vascular thrombosis. It can be acute, subacute, and chronic, persistently positive cardiolipin antibodies or lupus anticoagulant, often associated with other autoimmune diseases, and can be also in the absence of other diseases as well, which we will come to in a minute. So eventually, so much was observed about this disease around the world. There was an international consensus in 1999 where they developed certain criteria for diagnosis of phospholipid antibody syndrome. Because, as you know, the findings themselves, the pathology findings or the clinical manifestations are fairly non-specific and depend on the organ systems. But along with the serologic findings, it will give us a way out in terms of defining the diagnosis in a patient for appropriate therapy. So it is either an event of vascular thrombosis in any vessel or pregnancy, morbidity, and loss, and which has to be along with one of the following positive lupus serology, positive serologies, which can be anticardiolipin antibodies, antibodies to beta-2 glycoprotein.